Let me know once you're ready. Can you hear me?
Yes, okay, sir.
Okay, okay,
Ready, sir.
okay. Please start.
Hi, I'm Millie, one of the registered nurses working here in this hospital ward. How are you?
I'm all right, thanks.
Okay, from your reports, I understand that you are admitted here following an anaphylactic reaction after chemotherapy. Is that correct?
Yes, unfortunately.
And I am here to monitor your vital signs, especially temperature, blood pressure, in order to understand your condition.
Okay.
Is that all right?
Yes,
Before
okay.
proceeding, before proceed any further, I would like to collect some information for the documentation purpose. Is that all right?
Definitely.
Do you experience any headache?
Yes, I have severe headache.
I am so sorry to hear that. Do you have any fever?
I don't know whether I have fever, but I'm really frightened, and I had some sort of allergic reaction. I couldn't breathe. Now I can breathe better.
All right.
Hmm.
Do you experience any other symptoms?
No, mainly it's a headache.
All right. Thank you for sharing all these informations. Now, based on the discussion, I can say that the headache you are experiencing is related to dehydration and exhaustion after the chemotherapy, and it may be due to the allergic reaction to the chemotherapeutic drug. Is that clear?
Yeah, it's some sort of allergic reaction. I feel like that.
Okay, by the time I can provide you some kind of fluids, means a cup of tea, so that you will be get some reduction in your pain. How does that sound?
You will get some relief. Yes.
You will get some relief in your pain. How does that sound?
Yeah, pain relief is a good idea. I wouldn't mind a cup of tea.
All right. Do you have any
But
other questions regarding
yeah,
your
how
condition?
long do I have to stay at the hospital? Can I go earlier?
You first of all, you need to we need to understand your situation. We
Hmm.
need to do the complete assessment of your condition. Once your condition is stabilized, we can think about your discharge when you can go from the hospital. But it mainly depend on the doctor's decision. So please stay here in the hospital. After the doctor's consultation, doctor will decide when you can leave from the hospital. Is it clear?
It's clear, but mm, okay. But I hope my chemotherapy treatment is not affected. Is it successful?
There is nothing to be worried. It is possible to develop some sort of allergic reaction in case of certain medications, but there are different options are available to manage the situation.
Hmm.
Is that clear?
Yes, another thing I am worried about is that I was supposed to be in the hospital for only a few hours, and my family is expecting me to be back, and they would be worried if I do not show up. So, can I leave earlier?
Yeah, I can really understand your situation, but don't worry. I will make necessary arrangements to inform your family regarding your situation. Before that, I would like to inform you that it is very important to monitor your condition because your vital parameters should be stable or it should be within the normal limits. For example, you told you have been experiencing some difficulty in breathing, so your breathing pattern should be normal and you need to maintain a normal level of oxygen saturation, and moreover your blood pressure and temperature should be within normal limits. So it is very important to monitor and your vital parameters should be within normal limits. Do you understand?
Yes, but I'm very hungry. I haven't eaten anything since morning.
Yeah, I'm really understand your situation. It is very difficult to stay without eating
I am
anything,
I am
but
really Ella. I really understand.
I really understand your situation, and it is very difficult to stay without eating anything. But I will discuss with your doctor regarding the food requirements, and after that, let you know regarding the food, whether you can take food or not. Do you
Okay.
understand?
Okay, if you say so.
And moreover, I would like to explain to you that there are alternative chemotherapy drugs are available to manage the allergic reaction, like immunotherapy
5 minutes.
and slow delivery mode of drug. And you will get more information from the doctor. It was nice talking to you. Thank you very much for your participation. Thank you.
There are blah 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 R double R ഉപയോഗിക്കല്ല്. There are chemotherapy are available എന്ന് പറയല്ലേ. There are available എന്ന് പറഞ്ഞാൽ മതി. ഇതിന്റെ ഇൻട്രൊഡക്ഷൻ ഒന്നുകൂടെ പറഞ്ഞേ പ്ലീസ്.
Hi, good morning. Hi, I am Millie, one of the registered nurses working here in this hospital ward. How are you?
Not well.
From your records, I came to know that you are admitted here following an anaphylactic reaction to chemotherapy drug. Is that right?
Yes. അപ്പം ഐ എം നോട്ട് വെൽ എന്ന് പറയുമ്പോൾ അതിന് റെസ്പോൺസ് കൊടുത്തില്ലല്ലോ, എമ്പതി ചെയ്തില്ലല്ലോ.
I'm so sorry to hear that.
Hmm.
Don't worry. You are at the right place. We will provide you effective treatment and care so that you will be all right. Please
Yes.
be relaxed.
Okay. All
And
right.
I am here to observe your clinical parameters, mainly monitoring your temperature, blood pressure, and your respiratory respiration.
Okay. Do it one more time, please. Introduction.
Hi, I am Millie, one of the registered nurses working here in this hospital ward. How are you?
Not that great, you know.
I'm so sorry to hear that, but there is nothing to be overly concerned because you are at the right place. We will
Okay.
provide effective treatment and care so that you will be all right. Please be relaxed.
Please be
Relaxed.
relaxed. Okay.
For our better communication, can you please tell me your name?
My name is John.
Thank you, Mr. John. Mr. John, I am here for monitoring your vital parameters, especially your temperature and blood pressure. Is that all right?
Yes. Okay.
Yeah, before proceed any further, I would like to collect some information for the documentation purpose. Is that all right?
Before proceeding any further, ing. Before
Before proceed any further
no,
എന്ന് പറഞ്ഞാല്
before we proceed any further, correct ആണ്. ബിഫോർ പ്രൊസീഡിങ് എനി ഫർദർ ഇതിലേതെങ്കിലും ഒരെണ്ണം. ബിഫോർ വി പ്രൊസീഡ് എനി ഫർദർ എന്നൊന്നി പറയുക, അല്ലെങ്കിൽ ബിഫോർ പ്രൊസീഡിങ് എനി ഫർദർ, either one.
before we proceed any further,
I would like to collect
I
some
would like to
information for
collect some
documentation
information
purpose.
for the documentation purpose. Is that all right?
Yes, that's good. Okay,
Do
that's
you
good.
experience any headache?
Yes, lot of headache.
Is there any difficulty in your breathing?
Yes, really, I was feeling a lot of difficulty in breathing, but now it's better.
Do you drink adequate amount of water?
I hope I have drunk enough water. I had drunk 2 cups of water.
All right. Do you
Okay.
experience any associated symptoms with this?
Any other?
Any other symptoms with this?
First, I had a elevated temperature. Everything is fine now, apart from this headache.
Okay, all right. From our discussion, I came to know that the reason for your headache is due to dehydration or due to exposure related to chemotherapy, or it may be due to after effect of allergic reaction. Is
അപ്പോൾ
that clear?
പോസിബിലിറ്റി പറയുമ്പം ഈസ് എന്ന് പറയല്ല, കുഡ് ബി പോസിബിലിറ്റി ആയിട്ട് പറയാം.
It could.
ഐ തിങ്ക് ഇറ്റ് കുഡ് ബി. ഐ കെയിം ടു നോ എന്നുള്ളതിന് പകരം പെർഫെക്റ്റ് ടെൻസ് ഉപയോഗിക്കാം. ഐ അസ്യൂം, ഐ ഹാവ് കം
Uh,
ടു നോ എന്ന് പറയാം. അല്ലെങ്കിൽ ഒരു പോസിബിലിറ്റി ആകുമ്പം ഐ അസ്യൂം ദാറ്റ്,
uh,
ഇറ്റ് സീംസ് ദാറ്റ്,
uh,
ഇറ്റ് ലുക്സ് ലൈക്ക്.
uh.
All right, good job. Let's go to another task.
Sir.
Malaria prophylaxis ചെയ്തതാണ്. How about this? Home visit
എത്ര പേജ് സാറേ?
60. ചെയ്തിട്ടുണ്ടോ?
ഇല്ല സാറേ.
Let's do it. Your time starts now. You're 76. So home visit ഒക്കെ നല്ലതായിട്ട് ചെയ്യണം. Introduction. Do not be confused.
ഉം. ഉം.
That's 3 minutes. Please start speaking.
Hi, I'm Millie, one of the registered nurses coming from the nearby community health center. How are you?
I'm all right, thanks.
From your records, I came to know that you have undergone a hip replacement surgery 6 weeks before. Is that right?
Mm, yeah, better you had undergone. ഇല്ലേ? Past
Yeah.
perfect അല്ലേ?
Ah,
You have undergone എന്ന് പറയുമ്പം present അല്ലേ?
ah.
ഒന്നെങ്കിൽ you had undergone അല്ലെങ്കിൽ you underwent. Better. Okay.
ഒന്നുകൂടെ തുടങ്ങാവേ.
Mm.
Hi, I'm Millie, one of the registered nurses coming from the nearby community health center. How are you?
I'm all right, thanks.
From your records, I came to know that you had undergone a hip replacement surgery 6 weeks before. Is that right?
Yep.
Can you please confirm your name for me?
Yes, my name is Mary.
Thank you, Miss Mary. Miss Mary, I am here to do a follow-up assessment after your hip replacement surgery. Can I proceed with that?
Yes. Okay, അതൊന്നുകൂടെ ചെയ്തേ.
Be- Hi, I am Millie, one of the registered nurses coming from the nearby community health center. How are you?
I'm all right.
Can you please confirm your
My
name
name
for me?
is my name is Mary.
Thank you, Miss Mary. From your records, I have come to know that you had undergone a hip replacement surgery 6 weeks before. Is that right?
Right.
Mary, I am here to do a follow-up assessment after your hip replacement surgery. Can I proceed with that?
Okay.
Before we proceed any further, I would like to collect some information for the documentation purpose. Is that all right?
Yes.
Do you have pain?
Mm, not much.
Do you experience any anxiety?
No.
Are you able to move your legs?
Yes, I can move my legs. I can walk a little bit, but I have some pain on my face though.
Oh, I'm so sorry to hear that. Is it a what type of pain is it? Is it a headache or something else?
പെയിൻ എങ്ങനെയാണ് ഹെഡേക്ക് ആവുന്നത്? ഫേസിലെ പെയിൻ അല്ലേ പറഞ്ഞത്? അതെങ്ങനെ ഹെഡേക്ക് ആവുന്നത്?
Hmm.
ഇറ്റ്സ് നോട്ട് മാച്ചിങ്. What can you ask?
Can you specifically say where exactly is the pain?
All over my face. You can ask, is it a pricking pain or throbbing pain or just continual pain or temporary pain, a lot of
What
pain?
kind of pain
Yeah.
is it?
Yeah, I think it's kind of pricking pain.
Are you experiencing any fever?
Yeah, no.
Is there
But
any change in your app?
yeah, but I had a fever in the morning. Now I am better.
Okay. Is there any change in your appetite?
No.
Is there any change or is there is any loss of sense of your taste?
No.
Okay, thank you for sharing all this information.
Okay.
From our discussion, I suspect that the possible reason for your the sleep കാര്യം ചോദിച്ചില്ല.
യെസ്, ഒന്നും വിട്ടുപോകല്ല. ക്യാൻ യു ഡു ദാറ്റ് അഗൈൻ? ഇൻഫർമേഷൻ ഗ്യാതറിങ് കുറച്ചുകൂടെ ഫ്ലുവൻ്റ് ആയിട്ട് ചെയ്യും. അതിൻ്റെ ഒന്നും മിസ്സാകാതെ ചെയ്യും. 1 2 3 4 അങ്ങനെ ചെയ്യും.
Sorry.
ഓക്കെ.
Before we proceed any further, I would like to collect some information for the documentation purpose. Is that all right?
Yes.
Do you have pain?
I experience pain on my face.
Okay, I'm so sorry to hear that. What type of pain is it?
What do you say? Some kind of pricking pain.
Do you get pain all the time?
Yeah, it is continuous.
Oh, I'm so sorry to hear that. Do you get adequate sleep?
I couldn't sleep last night properly.
All right. Do you experience any anxiety or stress?
I'm not anxious nor am I stressful.
Are you able to move your legs?
Yes, I can even actually walk. It's better than before.
Oh, I'm happy to hear that.
But I
Are
feel
you
tired.
experiencing?
I feel tired all the time.
All right.
Hmm.
Are you experiencing any fever?
Fever? No. No.
Is there any change in your appetite or sense of taste?
No.
Okay, thank you for sharing all this information. From our discussion, I came to know that the possible reason for your poor sleep is due to anxiety, stress, and the pain and the slight pain you are experiencing, facial pain you are
അത്
experiencing. Is
കോൺട്രഡിക്റ്റിംഗ്
that clear?
ആണല്ലോ. കോൺട്രഡിക്റ്റിംഗ് ആണല്ലോ. ഞാൻ പറഞ്ഞില്ലേ ഞാൻ ആങ്ഷ്യസ് അല്ലെന്ന്.
പറഞ്ഞു അപ്പൊ ഇവിടെ ഇങ്ങനെ പറയണ ആങ്സൈറ്റിയുടെ കാര്യം പറയണ്ട
Yeah,
സ്ട്രെസ്സും
yeah.
ഇല്ലെന്ന് പറഞ്ഞായിരുന്നല്ലോ.
I said I'm not stressful, stressed. I'm not anxious. I came to know that this is the, it's a possibility. It could be എന്ന്
Ah,
പറയണം. So don't just follow the script entirely. Means listen to the patient also.
ah,
The patient may
okay,
interlocutor may something else, may say something else. So
okay,
accordingly you have to
okay.
react. That means you are not
Okay,
paying
from our
attention.
discussion,
Yes, means
the
yeah.
the possible reason for your poor sleep could be the facial pain you are experiencing. Do you understand?
No, നല്ലതായിട്ട് പറ.
From our discussion, I could say that the reason for your poor sleep is the facial pain you are experiencing.
ഏത് ഏതാ
The
പറയുന്നത്? ഏത് ടാസ്കാ പറയുന്നത്?
അല്ല, ആദ്യത്തെ ടാസ്ക് എക്സ്പ്ലോർ ദ
Explore the possible
പോസിബിൾ
reasons for the patient's poor
സ്ലീപ്പ്
sleep. അതിന് എക്സ്പ്ലോർ ചെയ്യാന്ന് പറഞ്ഞാൽ കണ്ടെത്തുക, ചോദ്യം ചോദിക്കുക.
ക്വസ്റ്റ്യൻ
അത്
ചോദിക്കുക.
ഓൾറെഡി ചോദിച്ചു കഴിഞ്ഞു.
ആ,
Do you have
ആ.
anxiety? Do you have stress? Do you have any pain? Etc. തീർന്നു. Find
അപ്പൊ
out more about
അതിനെങ്ങനെ
patient.
പറയണ്ട.
എങ്ങനെ പറയാൻ പറ്റും? എന്തോ പറയാൻ ശ്രമിച്ചത്?
അല്ല, ഇത് റീസൺ ഇതുകൊണ്ടായിരിക്കും പോർ സ്ലീപ്പ് ഉണ്ടായെന്ന്.
നോ,
ഫേഷ്യൽ
യു
പെയിൻ കൊണ്ട്.
മിസ്അണ്ടർസ്റ്റുഡ്. അത് അങ്ങനെയാണെന്നല്ല പറഞ്ഞേക്കുന്നത്.
ഉം.
എക്സ്പ്ലോർ ചെയ്യുക. നമ്മൾ മനസ്സിലാക്കാൻ
ആ,
ശ്രമിക്കുകയാണ്.
മനസ്സിലായി.
നമ്മൾ എൻക്വയറി ചെയ്യുക. ഇതാണോ
ഓക്കെ,
ഇതാണോ
ഓക്കെ.
ഇതാണോ. നമ്മൾ ഇതാണെന്ന് പറയല്ല. ആണോ എന്ന് ചോദിച്ചിട്ട്
ആ,
എന്തിനാണ്
ആ,
നമ്മൾ പറയുന്നത്? ഡു യു ഹാവ്
ആ, മനസ്സിലായി,
ആർ യു
മനസ്സിലായി.
ആങ്ഷ്യസ്? ഡു യു ഹാവ് സ്ട്രെസ്? ഡു യു ഹാവ് പെയിൻ? എക്സെട്ര. അടുത്ത ടാസ്കിലോട്ട് പോകുന്നു. More about symptom.
ഉം,
I
ഉം.
also would like to know if you have a uh, about the headache. So what type of headache is it? On a scale of 1 to 10, 1 being the least, how much is your headache? അത് റേറ്റ് ചെയ്യാൻ കൊടുക്കുക. Does it become, does it get worse when you move? Do you have fever? Do you have change in appetite? Do you have any loss of sense of taste? ഇത്രയേ ഉള്ളൂ. 1 2 3 4. അടുത്തത് ഇങ്ങനെ ഇങ്ങനെ പോവാ. ഇത് ഇതിൻ്റെ ഒത്തിരിയും ക്വസ്റ്റ്യൻസ് ഉണ്ട്.
അല്ല, അല്ല, ഇതിപ്പോ രണ്ടായിട്ട് ചോദിക്കണ്ടായിരുന്നോ?
ഏതാ?
അല്ലെങ്കിൽ കണ്ടിന്യൂസ് ആയിട്ട് എക്സ്പ്ലോർ പോസിബിൾ റീസൺ ഫോർ പേഷ്യൻസ് പോർ സ്ലീപ്പ്,
ഉം.
അല്ലെങ്കിൽ ക്വസ്റ്റ്യൻസ് എല്ലാം ഇൻഫർമേഷൻ ഗ്യാതറിംഗ് ഒന്നിച്ച് ചെയ്താൽ മതിയായിരുന്നോ?
അതെല്ലാം അതെല്ലാം ഇൻഫർമേഷൻ ഗ്യാതറിങ് അല്ലേ? 1 2 3 എല്ലാം
ആ,
പെട്ടെന്ന് പെട്ടെന്ന് ചോദിച്ചു പോകണം. കാരണം അല്ലെങ്കിൽ ഒത്തിരിയും ഉണ്ട്. 1 2 3 ചോദിച്ചു പോവാ പെട്ടെന്ന് പെട്ടെന്ന്.
ആ. അപ്പൊ ഡു യു ഹാവ് ഹെഡ് ഏക്ക് ചോദിക്കുമ്പോ ഹെഡ് ഏക്ക് ഇല്ലെന്ന് പറഞ്ഞാൽ പിന്നെ നമുക്ക് സിവിയറിറ്റി ഓഫ് ഹെഡ് ഏക്ക് ചോദിക്കാൻ പറ്റത്തില്ലല്ലോ.
പറ്റത്തില്ല. യു ആസ്ക്
ആ,
ഹെഡ് ഏക്ക് ഉണ്ടോ എന്ന്. ഇല്ലെങ്കിൽ ഇല്ല, അന്നേരം അത് സ്കിപ്പ് ചെയ്യും. അത്രേ ഉള്ളൂ. ദെൻ എക്സ്പ്ലോർ അതർ
ആ,
തിങ്സ്.
ആ.
For documentation purpose, I would like to collect some information.
ആ.
He said, okay, yes. Please tell me, do you feel anxious? No.
ആ.
Continue.
Do you feel anxious? No. Do you
No.
experience any stress? Do you
Uh,
have pain?
ഞാൻ ആൻസർ പറയട്ടെ. നോ.
Do you have headache?
അത് എല്ലാം കൂടെ കുളമായില്ലേ? ഓക്കെ, യു സ്റ്റാർട്ട് ഫ്രം ബിഫോർ വി പ്രൊസീഡ് ഇനി ഫർദർ. അത് വെച്ചോ, കൺഫ്യൂഷൻ വരുത്താതെ.
Before we proceed any further, I would like to collect some information for the documentation purpose. Is that all right?
Yes.
Do you get adequate sleep?
No, actually, I couldn't sleep for the last few days, and I'm feeling really tired. Maybe because of that.
Oh, I'm so sorry to hear that.
Hmm.
Do you experience any anxiety?
I'm not anxious.
Do you have any pain?
Yes, I feel pain on my face a bit.
What kind of pain is it?
How to say? Maybe kind of pricking pain.
All right. Do you experience any headache?
Yeah, I've been experiencing headache for the past few days.
Oh, I'm so sorry to hear that. On a pain scale of 1 to 10, 1 being the least and 10 being the highest, what's your pain score?
Maybe three. Three.
All right. If there is anything that worsen your pain,
Is there
for
is
example, while
is
moving
there
your
is
foot,
illa? Is there anything?
is
Double
there
is varilla.
anything? Is there anything that worsen your pain, like moving your head or something?
Is there anything that worsens your pain? No.
Do you experience any fever?
I had cold last week, and my nose was badly blocked, and I think that's why my sleep was disturbed.
All right. Is there any change in appetite or loss of sense of taste?
No.
Okay, from our discussion, the symptoms suggest that you are suffering from acute sinusitis.
Okay.
Do you heard about the sinusitis?
Have you heard?
Have you heard about sinusitis?
Have you heard? Alle, do you know? ഇതിലേതെങ്കിലും ഒരെണ്ണം. Yeah, I don't know much about it. I've heard about it though.
Yeah, don't worry, I can explain to you what is the sinusitis. It's an inflammation of sinus, that is the lining at the back of your nose. When it is inflamed, you will feel this facial pain and some secretion, accumulation of secretion in your nose. Is that clear?
Okay.
But there is nothing to be overly concerned about it because this condition is usually self-resolving.
Mm-hmm.
That and it is temporary. It is temporary. It will stay for only for a short duration, and it is not a serious condition. Is that
Mm-hmm.
clear?
Yes, yes.
And I can
I
also,
remember. I remember. Whenever I lean forward, my headache becomes worse. Yeah, now I remember.
yeah, whenever you are experiencing this sinusitis, if there is any change in position of your head, the pain will worsen. It is a common symptom of sinusitis. Is that clear?
Yes. Okay. So what should I do? Also, I feel a lot of pain when I eat. That's why my I don't eat much nowadays.
Don't worry, I can suggest some of the effective measures that you can follow to manage your condition. First of all, you need to increase your fluid intake so that the secretions which is accumulate in your nose will be loosened so that it is easy to drain out the secretions. Is that clear?
Okay.
So when you are blowing your nose, you should do it very gently so that you can avoid excessive exertion and breakage of any small tissues. Is that clear?
Okay.
And it is very important to elevate your head on a pillow while you are lying down. Will you able to do that?
While you lie down, simple tense. Yes.
Okay, thank you. It's a good decision. Now, do you have any other concerns regarding your condition?
No, I'll just follow your suggestion. And should I go and visit GP if I don't see any improvement?
Yeah, it's a good concern, Miss Mary. It is important to consult with your doctor, with your general practitioner, if there is no improvement of your condition after 1 week. Is
Okay.
that clear?
Yes, yes, I'll do that.
And your doctor will prescribe appropriate treatment based on your condition.
Mm-hmm.
And moreover, he can rule out if there is any associated illness or the exact cause of your problem.
Okay,
Is that
that's
clear?
5 minutes. Thank you.
Thank you very much for your participation. Thank you.
So, what do you think? How did you do? Did you do well? Better?
Yeah.
Worse? Okay. What can you improve? Where do you lack?
ക്വസ്റ്റ്യൻ കൃത്യമായിട്ട് വായിച്ച് മനസ്സിലാക്കണമായിരുന്നു ഓരോ ടാസ്ക്.
യെസ് അപ്പം സെക്കൻഡ് ടാസ്ക് വായിച്ചത് ടോട്ടലി മിസ്അണ്ടർസ്റ്റുഡ് ആണ്.
ആ
എക്സ്പ്ലോർ പോസിബിൾ റീസൺ. എക്സ്പ്ലോർ ചെയ്യുന്ന പറഞ്ഞാൽ നമ്മൾ എക്സ്പ്ലോറർ എന്ന് പറഞ്ഞില്ലേ, പോയി കണ്ട് നോക്കുന്നത്.
ആ
അതുതന്നെ ആസ്ക് ക്വസ്റ്റ്യൻ.
ആദ്യത്തെ രണ്ട് ടാസ്ക് ഇൻഫർമേഷൻ ഗ്യാതറിംഗ് ആയിരുന്നു. അത് കഴിഞ്ഞിട്ടായിരുന്നു മറ്റേ കൺക്ലൂഷനിലോട്ട് വരേണ്ടത്.
മൂന്നെണ്ണം ഇൻഫർമേഷൻ ഗ്യാതറിംഗ് ആണ്.
രണ്ടെണ്ണം
മൂന്നെണ്ണം
രണ്ടെണ്ണം
ആണോ? ഫൈൻഡ് ഔട്ട് ഹൗ പേഷ്യൻ്റ് ഈസ്
മൂന്നെണ്ണം
ഫീലിംഗ്.
മൂന്നെണ്ണം.
ഓക്കെ. എക്സ്പ്ലെയിൻ ദ റീസൺ സജസ്റ്റ്. അത് കഴിഞ്ഞിട്ട് നമ്മൾ ഇൻഫർമേഷൻ ഗിവിംഗ് ആണ് നാലാമത്തെ ഇതിൽ ചെയ്യുന്നത്,
ആ
അല്ലേ?
ആ
എക്സ്പ്ലെയിൻ സിംറ്റംസ് സജസ്റ്റ്. ഇറ്റ് ലുക്സ് ലൈക്ക് എന്ന് പറയുമ്പോൾ നമ്മൾ ഇറ്റ് സീംസ് ലൈക്ക്, ഐ തിങ്ക് എന്നൊക്കെ പറയുമ്പോൾ സജഷനാണ്, ഇതാണ്
ആ
എന്നല്ല പറയുന്നത്.
ആ
It looks like as if you are suffering from acute sinusitis. which means when you use technical terms like sinusitis, this patient may not
Ah,
understand. So you have to explain whenever
ah,
you use a medical term, you have to give
ah,
explanation. That's very important.
ah,
Otherwise, you could lose your mark. It
ah,
seems like you are suffering from acute sinusitis, which means the in sinus linings on the back of at the back of your nose is inflamed, so causing this
ah,
pain and disturbance. Do you understand? കണ്ടോ അങ്ങനെ
ah.
ചോദിക്കാം.
Hmm.
Please do not be alarmed. Usually, this will subside by itself. You do not have to do anything. It's not a serious condition. Do you understand? Yes. So, you can do a couple of things by yourself in order to improve the condition. Shall I explain? Yes. കണ്ടോ അങ്ങനെയൊക്കെ ചെയ്തായിരുന്നോ? അതൊക്കെ ഇൻഫർമേഷൻ, പുതിയ ഇൻഫർമേഷൻ കൊടുക്കുന്നതാണ്. അപ്പോൾ അത് സ്ട്രക്ചറാണ്. നോട്ടീസ് ചെയ്തോ?
Ah, ah, ചെയ്തു.
Let me explain to you a couple of steps, possible treatments that you can do it by yourself. For example, എന്ന് പറഞ്ഞിട്ട് നമ്മൾ തരണം. പറയാം.
Hmm.
You can drink a lot of liquids, so that will loosen secretion. What is secretion? Secretions means storing അല്ലേ?
Ah,
Is that correct?
അതെ.
Can you hear me? Hello?
ആ കേൾക്കാം സാറേ.
Yeah. What's the meaning of secretion? Let me check. Then I think it's a collection, production, discharge. Okay.
ഡിസ്ചാർജ്.
Mucus thing. Okay.
Ah,
Medical term there. Okay. അത് ഓരോന്നോരോന്നായിട്ട് എക്സ്പ്ലെയിൻ ചെയ്യുക. Okay, good. Can we practice one more?
yes, sir.
Chicken pox. City cleaning. Can you take this, please? Page number 63.
ആ സാറേ. Yes, sir.
Yes. You're preparing, right?
Ah,
Okay, please start speaking.
Hi, I'm Millie, one of the registered nurses working here in City Clinic. How can I help you today?
Actually, I want some information. My son is just recovering from chicken pox. It's been a week, and I have a visitor. My niece would like to visit. She is pregnant, and I would like to know whether it is okay for her to come and visit.
Sure, I will be happy to assist you by giving proper guidance regarding chickenpox.
Thank you.
All right. Do you have any idea regarding this chickenpox?
Mm, Yeah, I know it's bad, and it's contagious. Hello,
Sir.
Duty.
It is contagious എന്ന് പറഞ്ഞിട്ട് സാർ നിർത്തിയതാ.
Yes. Wait for a second. ഇപ്പൊ അത് കേട്ടില്ലെങ്കിൽ you take over. That's all.
Okay. Yeah, I can explain to you what this chickenpox is. It is an infectious disease and it usually spread from person to person and it is infectious until the blisters have crusted over. Is that clear?
Yes.
Before we proceed any further, I would like to collect some information to know regarding the details of your niece condition. Is that all right?
Okay.
Did your niece had any previous exposure to chickenpox?
Did your niece?
Had
No. Did
any previous
did have on hard? Did hard വരത്തില്ല.
niece
Did
has any previous exposure to chickenpox?
no? Did have? Did she has എന്ന് വരത്തില്ല. Did she have?
Did she have any previous exposure to chickenpox?
I'm not sure though.
Okay, can you please tell me the gestational age of her pregnancy?
About 6 weeks.
All right. Did she suffer from any other illness?
I'm not sure. I have no idea.
Okay. Did she inform her regarding inform her regarding the chickenpox of your son?
No, actually, I haven't. That's why I wanted to check with you first before just alarming her unnecessarily as she is carrying. I do not want to give her any stress.
All right. So, for our better communication, can I know your name, please?
See, ആ നെയിമൊക്കെ തുടക്കത്തിൽ ചോദിക്കണം. I'm John.
Sir.
Yes, yes. It's okay.
Okay, thank you, Mr. John. Mr. John, I would like to tell you that it is better to inform your niece to delay her visit because she is in the early stage of her pregnancy,
Mm-hmm.
and moreover, you are not aware of her previous exposure to chickenpox.
That's right.
Is that clear?
Yes.
And moreover, the pregnancy period is a high risk period, and there is possibility to get many infectious disease. And if she is getting or if she is contracted with chickenpox, it can lead to serious complications like pneumonia and hepatitis. Do you have any idea regarding pneumonia?
No.
It's an infection of the lungs and it can lead to serious complications like serious respiratory complications. So it is better to delay her visit in order to consider the importance of her health. Is that clear?
Okay.
Do you have any idea regarding the treatment of chickenpox?
Mm, do I have to do any treatment now because my son is already well?
Yeah, there are different. The your son is already six.
എന്ത് പറ്റി ഒരു ഫ്ലോ ഇല്ലായിരുന്നല്ലേ?
അല്ലാത്ത കൊച്ചിന് എത്ര ദിവസമായി എന്ന് എനിക്ക് മനസ്സിൽ 4 year old എത്ര ദിവസമായി എന്ന്
ഏതാണ് പ്രശ്നം?
അല്ല ട്രീറ്റ്മെന്റ് എടുക്കണോന്ന് ചോദിച്ചത്. Your son is already recovering from the chickenpox, so no need of taking any treatment. But
Yes.
there are different treatment options are available at present, like injection containing antibodies. So,
Okay.
so if you are taking such medications, you can prevent the further occurrence of infection.
Okay.
So it is very important to advise your niece. Please delay her visit so she can avoid any such complications.
ഒന്നുകൂടി പറഞ്ഞേ.
Please,
Inform your niece.
please inform your niece to delay her visit
Yes.
in order to avoid any future complications.
Yes. In order
Is
to
you
avoid
able
the
to do that?
chances, in order to avoid any chances of the spread of
Getting
disease.
chicken pox.
ഇല്ലേ? Spread of disease.
Uh,
Okay.
do you have any other questions?
No.
Okay, I hope I have clarified all your concerns,
Hmm.
and I would like to know that is there anything that I need to clarify?
No.
Okay, to summarize our conversation, you are here to know regarding the chicken pox of your son, and moreover, to know more details regarding the visit of your pregnant niece, because if there is any possibility of getting
അതെങ്ങനെ ഒന്നുകൂടെ ബെറ്റർ
chicken
ആക്കി
pox.
സിംപ്ലിഫൈ ചെയ്ത് പറയാം.
Uh,
To summarize our conversation, we have discussed about the possibilities of spread of chicken pox,
uh,
and I have advised you
uh,
to take precautions and delay the visit of your niece for at least another week. And you can also you can also your son can also undergo vaccination in order to improve his what do you call that, antibodies, what do you say? Yes.
uh,
And so thanks for coming. Yeah, have a great day. ഇത്രയേ ഉള്ളൂ. Simplify it. Don't make it too complicated. നമ്മുടെ ഗ്രാമറൊക്കെ തെറ്റോടെ. ഒന്ന്
okay.
സമറൈസ് ചെയ്തേ.
To summarize our conversation, we discussed about the possibility of spread of chickenpox,
Mm.
and I have discussed it is important to delay the visit of your niece to avoid occurrence of any complications,
Mm.
and moreover, your son need to take injection containing antibodies so that he can prevent occurrence of any complications in the future.
Okay.
It's nice. It was nice to talking to you. Thank you very much for your visit.
It was nice talking to you. It was nice to talk to you. It was nice talking to you better. Okay, that's good.
Uh,
Now ask me questions. Do you have any concerns? Any questions? Doubts?
ഈ നാലാമത്തെ ടാസ്ക് ഗിവ് ഇൻഫർമേഷൻ അബൌട്ട് ട്രീറ്റ്മെന്റ് അവൈലബിൾ. അപ്പൊ ഈ കൊച്ചിന് ട്രീറ്റ്മെന്റ് എടുക്കണമെന്ന് അവിടെ പറയേണ്ടത്.
Sus need to be cautious and outline risk of catching chicken pox during pregnancy. Advice.
അല്ല അഞ്ചാമത്തെ ഫിഫ്ത്ത് ടാസ്ക്.
മനസ്സിലായി. ഞാൻ എൻ്റെ തൊട്ട് പുറകിലത്തെ വായിച്ചു നോക്കട്ടെ. അഡ്വൈസ് നീഡ് ഫോർ പേഷ്യൻ ടു ഇൻഫോം നീസ് അബൌട്ട് ദ ചിക്കൻ പോക്സ് ഡിലേ. ഓക്കെ. Okay. Stress need to be cautious and outline risk of catching chicken pox during pregnancy. Okay. സീരിയസ് കോംപ്ലിക്കേഷൻസ് ന്യൂമോണിയ ഇതൊക്കെ നമുക്ക് ഷീ കുഡ് ക്യാച്ച്. അത് പറഞ്ഞായിരുന്നോ?
പറഞ്ഞായിരുന്നു.
Okay. It's very important that she take proper care and avoid catching chickenpox, because during pregnancy it could be fatal. She could catch pneumonia, hepatitis, and so on. And the next one, give information about treatment available. Exam, injection containing antibodies, etc. Reaffirm need for his visit to be delayed. About a confusion whether it is for the niece or for the son. അല്ലേ?
ഉം, ഉം.
ട്രീറ്റ്മെൻറ്റ് അവൈലബിൾ എക്സെട്ര. ഇപ്പം ഇങ്ങനൊരു കൺഫ്യൂഷൻ വന്നാൽ യു ബെറ്റർ ആസ്ക് ദ ഇൻ്റർലിക്യൂട്ടർ. എന്താണ് ക്ലാരിഫൈ ചെയ്യുക. ഇസ് ഇറ്റ് ഫോർ ദ സൺ ഓർ ഇസ് ഇറ്റ് ഫോർ ദ ഇൻ്റൽ വട്ട് ഇക്കോ വിസിറ്റർ. ഇവിടെ എന്തുമായിരിക്കും? Give information about treatment available, etc. In example, injection containing
അത്
antibodies.
നീഴ്സിനായിരിക്കും അല്ലേ?
Yeah, വിസിറ്റ് ചെയ്യുന്ന ആൾക്കായിരിക്കും. It's better to avoid in case if she wants to really wants to uh, visit, she can take some precautionary steps. For example, she can take an injection containing antibodies so that she the chances of catching the disease could be prevented. Let me remind you. Please remember, you try to delay the visit of your niece as much as possible. Do you understand? അപ്പോൾ affirm ചെയ്തു. Okay, that's it. അപ്പോൾ എന്തെങ്കിലും ഇതുപോലെ കൺഫ്യൂഷൻ വരുവാണെങ്കിൽ ഡോണ്ട് ജസ്റ്റ് ഡു ദ റോൾ പ്ലേ, മേക്ക് ഷുവർ യു ആസ്ക് ദ ഇന്റർലോക്യൂട്ടർ. ഇപ്പം അല്ലെങ്കിൽ നമ്മൾ ചെയ്തുകൊണ്ടിരിക്കുമ്പോൾ കൺഫ്യൂഷൻ വരും, അന്നേരം ചോദിക്കാൻ പറ്റത്തില്ല. 3 മിനിറ്റ്സ് നല്ലതായിട്ട് യൂട്ടിലൈസ് ചെയ്യുക.
ആ
Do you have any doubts or questions that you would like to ask me today?
ആ സർ.
Okay, good. You're doing great. Avoid confusion. Apart from that,
ആ
wonderful. Okay?
ഓക്കെ സർ.
എന്തെങ്കിലും ഉണ്ടോ ചോദിക്കാൻ?
ഇല്ല സാറേ.
Okay, fine. Going well.
ഓക്കെ സാർ, താങ്ക് യു.
Okay. So, shall we wind up?
ഓക്കെ സർ.
And see you tomorrow. See you the next
നാളെ
class.
ക്ലാസ് ഇല്ലല്ലോ?
Yes,
ഓക്കെ,
yes.
ഇനി ട്യൂസ്ഡേ അല്ലേ സാറേ?
Monday. Online class is there.
ഗ്രൂപ്പ് ക്ലാസ്. ഓക്കെ, താങ്ക് യു സർ.
Yes, yes. Okay. See you then. Bye.
താങ്ക് യു.